we have this triplet combination clinical trial where we use Decitabine, Venetoclax, and in combination with Quizartinib, which is a second-generation FLT3 inhibitor that has been shown single-agent activity in relapsed refractory AML. As you may know, patients with FLT3 mutations, these patients tend to relapse faster than others, and also survival is poor. Particularly, this is even more so in patients with older adults who are FLT3 mutated, who have FLT3 mutated AML. Even with the hypomethylating agent and FLT3 combinations, the expected median overall survival is 8 to 9 months, which has been published by us and others with HMA plus sorafenib and HMA plus midostaurin combinations. Also, we know that there is a strong preclinical rationale combining Venetoclax with FLT3 inhibitors. Given that information, we designed this clinical trial where we combined Decitabine Venetoclax with a novel second-generation FLT3 inhibitor, Quizartinib, and we treated patients with newly diagnosed or relapsed refractory FLT3 mutated older AML patients, and we restricted the newly diagnosed cohort to those who are unfit for intensive chemotherapy. This regimen so far, this is our first report in this ASH 2020. And we have treated 11 patients with relapsed refractory FLT3 mutated AML. These patients are heavily treated. At least most of the patients received 2 or more prior therapies, and most of them had received prior FLT3 inhibitors or intensive chemotherapies. We evaluated the response rates. Composite CR rate was 81% in these relapsed refractory cohort, and approximately half of the patients achieved PCR or flow MRD negativity. And 55% of these patients were able to proceed with the bone marrow stem cell transplantation. And in the frontline cohort, so far we had 4 patients. And all of these 4 patients achieved CRC, and all of these patients achieved PCR negativity. In terms of toxicity, we have the most commonly seen toxicity was prolonged myelosuppression. We have seen about time to ANC recovery was about 50 days. Also, similarly, time to platelet recovery was about 46 days. So given these toxicities, we have amended protocol by reducing the number of Venetoclax from 21 days to 14 days in the first cycle, and going forward, the Venetoclax dose have been reduced to initially 14 days, could be even 10 days or 7 days. So, and the other important point that I would like to mention is the QTc prolongation, because this is usually was a concern in prior Quizartinib trials, particularly when the Quizartinib have been used on higher doses. But the doses that we used here, we tested 2 dose levels of Quizartinib in this combination, 30 and 40 milligram. Essentially, in this triplet combination, none of the patients had any clinically significant QTc prolongation. Saying that, this is an early and preliminary report, but we have seen highly effective response rates, and this study continues to enroll in both relapsed refractory and frontline newly diagnosed patients. And we expect to update our results in the upcoming meetings.